This is an important video for every single person, especially Black Americans. For Black people, especially Black Americans. And you have to take your time to watch, because when I honestly came across these clips, tears dropped out of my eyes. A lot of Black Americans go through the same issue, the same thing, but they don't speak out. This woman has literally gone through this like years ago before she decided to speak out. And from there, you see a lot of people in the comment section also saying, I went through this as well. Through this process, I lost this and I lost that. This is literally a sad story, but it's an important update for every single Black person. Credit belongs to the original creators of every single clips and stitches we have in our today's episode. If you have not subscribed, what are you waiting for? Please do what? Subscribe, like this video, drop me your comments, and lastly, do not forget to share. And for disclaimers, this is just for educational purposes only. I want to say a very big thank you to every single one of you liking my videos, sharing my videos, dropping commentaries, dropping super thanks, and also joining my membership. I do not take you guys for granted. With that being said, let's watch this video and I'll be back.
Story time on how racism is systematic. I'm pregnant. I'm a Black woman. I go into labor with my baby. They tell me what's going to happen. Baby comes, baby's premature. I breastfeed my children. Shocking, right? Because apparently Black women don't do that. But here's what I will tell you. This is where the systematic racism comes into play. Not being called the N-word, but literal systematic racism. They come in and tell me, we cannot give your daughter your breast milk because we found drugs in your system. I say, well, that's impossible because I don't do drugs. They say it was marijuana. I say that is also impossible because I don't smoke marijuana. They say, well, we found it in your milk and we cannot give her your milk. We're going to give her this formula. We need you to sign a paper for this formula we're going to give her. I say, fresh out of surgery, might I add, C-section, having these conversations. Daughter is 1 pound. I'm stressed out. They're telling me I'm a drug addict. Don't do drugs. So they then come in, a bunch of white women come in and say, well, do you eat lemon poppy seed? No, I don't. Actually, I'm actually vegan and I don't do any drugs. They then say, well, maybe your neighbors gave you some brownies. Maybe your neighbors made some brownies and it had weed in it and you didn't know. I say, I live in a community of people who don't make weed brownies. It's a 4-bedroom, 2-bath house, over 2,000 square feet, 2-car garage. I don't smoke marijuana or eat marijuana brownies. They say, well, we found it in there. I said it couldn't be mine. So now I am fresh out of surgery from being cut open on my stomach, being told by all of these white women that I live in a community that makes brownies and drugs me, right? Like I'm being drugged by my neighbors unknowingly, and I'm also doing drugs while pregnant. This is all being told to me fresh out of being cut open with a child that's 1 pound. Don't know if she's going to survive. No medical care or attention. It took for the hospital, the president of the hospital, to be called, demanding to retest my milk or there's going to be a lawsuit. I am post-surgery, guys. Not even 2 hours, let alone 12. Okay? I'm post-surgery and I have to advocate for my child, my Black daughter, to drink her Black mother's breast milk because I'm being gaslit this whole time so that they, and here's the kicker. What actually happened is they wanted to test a formula out on my daughter. And if you don't know this, trials and tests and studies are done a lot on Black babies because unknowingly they think that Black people are uneducated and they get you in a state where you are in survival mode and you don't take a second to pause and think and make an informed decision. So They thought the likelihood of me being a black woman and smoking weed while pregnant was high based on statistics. Well, guess what? They tested my milk, and the demand was you need to retest the same milk. You need to retest it. And guess what? There was no marijuana. And my daughter got to drink breast milk. I'm saying all that to say, when we think about systematic oppression, we do not understand how deep it runs. We do not understand that there is a literal attack on a black woman, especially when she's in medical care. So I don't want to hear all of this talking. And this is why I'm very loud when I say lower your tone. I'm not talking about you denying me or calling me the N-word. I'm saying that you are actively sit in a system that works against my people. And I'm not going to shut up about it because I know what it means to be systematically oppressed, experience systematic racism. Less than 2 hours after being cut open and having a baby that's 1 pound. I know that. And I have stories like that for days. So all of this yapping about it was old, slavery was this. Slavery is not the only issue that black Americans went through in this country. Okay? We know the date slavery started and the day it ended. And it hasn't stopped white people from being systematically oppressive towards my people. So I don't want to hear it. Okay? Lower your tone. I'm always going to be nervous when Caucasians are afoot. That's just me. I have a podcast, so if you like that story, make sure you go click the link in my bio and check it out. I'm talking to you. I'm talking to me too. Spotify, Apple, Google, Danielle to you, everywhere you could think of, okay?
Okay, TikTok. Oh, I did it. I was going to live stream you guys, but I had some complications. But anyway, little guys here. Listen to this shit. This is our 24 hours. I had him today, okay? So this is our 24 hours or whatever. Long story short, I was asked, did I do drugs during my pregnancy? Because the baby, there's 3 things she named. The baby keeps eating like this, going like this. So when he does that, you feed him, right? And he's hungry. So I just fed him again. It's like, I don't know how many times, but fed him. And he's nice, calm, and cool. Another thing. Oh, well, he goes like this because you took the covers off of him. And he is cold. Is he not? Does he do it when you put the covers back on him? No. Okay, then. 3. 3 because he sneezed a couple of times. He had snot. He's probably congested. He got snot coming out his nose. So I got this little thing. I took the snot out of his nose. Okay? Are you fucking serious? Are you... I'm trying to... We can't be normal. We can't do shit, y'all. I mean, and I'm sitting here getting contractions. Every woman knows what it's like after they give birth. You hurt. You hurt. And they don't even want to give me any pain pills. It's hilarious how we get treated. I'm ready to check out in the morning. Like 1, 2, 3, 4, like 4 or 5 hours from now. I'm ready to call me a fucking Lyft and check out. And I think I am.
I screamed, I went over the toilet and had my son, and they caught my son over the toilet. To be honest with you, I do think it is a racism issue. As I screamed, these midwives came out, the ones who didn't believe I was in labour, they came out. There was number twos all over the floor. It was the worst sight ever. There was blood all over the floor. They came out and I had to walk with him because the umbilical was swinging between my legs. I had to walk with him. They cut the umbilical, but they had to leave the rest of it dangling over. I was in shock, absolute shock. Even when they brought my son out, I thought, who's that? And after all of that, you would think that they would really think, okay, we've made a lot of mistakes here. After that, they left it afterbirth for me. So within a week, I was back at the hospital because I had a shower and the afterbirth fell all over the floor in the shower. I was feeling dizzy. Racism doesn't mean that someone has to say something nasty and offensive to you. Racism is just being treated differently because of your colour of your skin. And when you've gone through it enough, you know when it's there.
And as someone who has worked in and around maternity services for pretty much all of my life, can I just say how appalled I am, how sorry I am. You really didn't deserve that experience.
The NHS in England says it's committed to making maternity care safer for all women. The government says it's invested 165 million in the maternity workforce and is promoting careers in midwifery with an extra 3,650 training places a year.
I almost died twice while giving birth, and I almost lost my baby the last time I gave birth simply because I am a Black woman giving birth in America. On the last day of Black Maternal Health Awareness Week, I am going to share my story. Even though this is not my favorite story to share, I'm going to try very hard to get through it. Son was born at 41 weeks. I did not want to have a C-section, but I also was not going into labor naturally. So they informed me that I had to be induced. And when I got to the hospital, they gave me Pitocin, and immediately the pain was way too much and I could not handle it. So I had asked for an epidural. They gave me the first epidural, and the epidural did not work. The doctors came back and said maybe it's just how the epidural was administered, and to just wait it out, and they will come back and give me another one. A couple hours later, they gave me another epidural. It was also not working. At this point, I've been in labor for over 20 hours, and my labor is not moving. I am stuck at like 5 centimeters. The doctor then informed my husband and I that I'm most likely going to end up getting a C-section. But because I'm not catching the epidural, during my C-section, I'm probably going to have to be under. They're going to have to use different forms of anesthesia, and I won't be awake during that C-section. I refuse to fall asleep or not be awake during my delivery, so I said I do not want a C-section. I want to keep trying to labor. After about 2 days of being in labor and being in excruciating pain because of all of the Pitocin they're giving me to induce a labor, they're not giving me anything to eat. They're not giving me any water. The doctor said they can't give me anything because my labor and delivery is most likely going to end up into a C-section. So I'm just sitting there starving in pain and in labor. I had my mom and my husband there with me, and I remember both of them asking for them to give me food, at least something to drink. I think my husband literally told the nurse like she needs to drink something. She has absolutely no energy to continue doing this labor. So they gave me like a drop of water, maybe some ice to chew on, and I'm still in labor. I'm still not moving, and I cannot labor on my feet because they had tried to give me an epidural. They gave me a third epidural, which also did not work, and they still would not let me labor on my hands and feet or anything. By the grace of God, we finally got a Black doctor. She was actually from Senegal, and she spoke French, and my mom spoke French. So my mom ends up speaking to her and saying that there's like an oil method that we use back home in Africa. My mom has 9 kids. She's been trying to tell these doctors to let her try something with me to help me induce the labor. The doctor finally lets my mom, and I go from 5 centimeters to 8 centimeters, and it's finally time to push. I have absolutely zero energy since I have not eaten in days. So my mom tells the doctor she needed to give me something to eat so that I have the energy to push. So she finally lets me have like a little bit of ice, and I think it was like broth. And I end up pushing my son and delivering my son after 30 minutes of pushing. About 6 minutes after I delivered my son, I start hemorrhaging badly. I am losing a lot of blood. There's just blood all over the floor, buckets of blood. Doctors are rushing in. They're telling my husband to come by my side to help keep me awake so that I can stay with them. At this point, am kind of going in and out and passing out. My mom is on the side praying. My husband is beside me trying to keep me awake. And I remember him just telling me to focus on the sound of my baby. So I stay up, and I don't know how long or what time it is. I finally
They were able to finally stabilize me. And one of the doctors that was standing next to me literally comes to me laughing and goes, "We almost lost you there for a minute." And that was my first labor and delivery story. My second labor and delivery story was with my identical twin girls. My identical twin girls were monodyne twins. They were very high risk twin pregnancy. So we've been going to a high risk doctor the whole pregnancy. At 32 weeks, we went there and they told me that the girls were they're in danger and we had to be rushed to the hospital for an emergency C-section. As you can remember, I don't take well to the epidural, so the emergency C-section, I let them know over and over and over again that, hey, I was given like 3 epidurals my last delivery and I don't take well to them. My husband is also telling them. My husband even acts like I have to be in the room with her every single second. I will not let you guys take her without me. But unfortunately, when they were giving me the epidural, they wouldn't let my husband go in that particular area, so he had to meet us in the operation room for the C-section. While they were giving me the epidural, I remember telling the guy, he was like, "Oh, do you feel that?" I was like, "Yeah, I can still feel that." He was like, "It's gonna take a minute for the anesthesia to kick in," and that was that. They start the process of the C-section with my twin daughters, and everything is great. Everything is going. I can't feel anything. My first daughter is born, Afia. They put her in my hand, and the NICU team takes her. And it's time to deliver the second twin. At this point, I have this feeling where it's like I can feel people's hands in my stomach. So then I'm like, I can't really talk too well, but I'm like, hey, I feel people's hands in my stomach. And my husband got close and said, "What did you say?" And then a rush of air, like a bunch of air just went into my stomach, and I felt the most excruciating pain. I told my husband I can feel them in my stomach, and of course from the pain I passed out. But I did hear my husband screaming and said, "She can feel you, she can feel the pain." And then the guy like rushing to give me more meds, and I don't remember anything after that. I was very out of it, very drowsy, kind of like passing out. My second daughter was born. I did not really come back to until after I was in post-op, and that's when I was able to wake up and go see my daughters. For my third pregnancy, I wanted to have a VBAC. A VBAC is basically a vaginal birth after a C-section. I was a pretty good candidate since my C-section was not because of my body, it was because of the twins coming early. I found a Black doctor that was able to help me. She was amazing. I did all the right things during my pregnancy. I worked out. I had a doula. I wanted to go into labor naturally, and I did. I was about 5 centimeters dilated when I got to the hospital. They immediately gave us a room. We got in the room and everything was going great. My son was early, like not quite full term, but almost full term. While I was in labor, they said my blood pressure rose very high, so they had to give me magnesium. Because of the magnesium, it makes you very tired. It makes the baby tired. It makes it very hard for the baby to breathe. I went into labor on my hands and feet because the labor kind of just stopped. It wasn't really moving very fast. We asked the nurse. She said she could not help us because she didn't have the time. So we told her my husband can help me. Before the nurse walked out of the door, she checked me and I was still at 6 centimeters dilated. She left. My husband helped me to labor on my hands and feet. I called my mom. I was doing some circulation motion, and all of a sudden I had that feeling like I have to poop. If you've ever had kids, the feeling that you have to poop means that it's time to push. I tell my husband calls the nurse and says, "Hey, my wife feels like she has to poop, like this is it." The nurse goes, "No, there is no way. I just checked her. She was at 6 centimeters. The nurse leaves. I have this huge contraction and I'm like, "Oh my God, babe, something is happening." My husband literally runs out of the room, calls the nurse back and goes, this is important. She feels like something is happening. The nurse also brushes us off. However, my husband literally screams and goes, "Go get the doctor right now." So the nurse finally rushes to get the doctor. The doctor comes in, tells me to close my legs because she's like, we need the NICU team here before we deliver your baby. Unfortunately, it was just too late and I had to push. So I pushed my baby and hoped and prayed that the NICU team was on their way so that they can help him breathe if he needs help breathing. My son was literally born after one big push. And like the doctor thought, he needed help breathing. And thank God the NICU team got there just in time to help my son breathe because he could not breathe when he was born. Had the NICU team not gotten there on time, I would have lost my son. There should be absolutely no reason that these are my labor and delivery stories. As difficult as it is to share my story on Black Maternal Health Week, it is so important that us as Black moms take our health in charge. It is important to have someone there that will advocate for you. It is important to try and find someone who looks like us in these spaces. I hate that this is my birth story. I hate that it's my birth story simply because I'm a Black woman in America giving birth. But I do hope that my story helps another mom know what to prepare for, how to prepare, and know the importance of having someone there who can advocate for them, because I should not have to worry about losing my child because a nurse didn't listen to me. I should not have to worry about losing my life because a doctor didn't listen to me. But unfortunately, we live in the world that is, not in the world that should be. Black women are 4 times more likely to die during labor and delivery compared to all the other races. Also have increased risk of pregnancy-related complications. Unfortunately, my story is not unique. There are so many other Black moms who have the same exact story. I am thankful for weeks such as Black Maternal Health Week. I am thankful that my kids are here and they're healthy and they're safe. I am thankful that I'm here and I'm healthy and I'm safe, because unfortunately, there are so many other Black families who cannot say the same, who cannot say their babies are here, and who cannot say that their wives, their sister, their mother is still here with us.
Another mother has come forward to share her birthing experience with Dr. Jackie.
I have been quiet about this for a very long time, but this has kind of felt like the straw that broke the camel's back. So in 2016, when I moved to Atlanta and I was pregnant already, expecting my son, when I was looking around and asking friends at the time for OBGYNs, everybody recommended Dr. Jackie. So, of course, I didn't know who she was, but I'm like, well, she got to be good if all y'all are going to her and there is no connection between these ladies that recommended her, so let me go to her too. Long story short, my son ended up being a stillbirth 36 weeks in my pregnancy. 3 days after I had had my appointment with Dr. Jackie.
Now, she will go on to say that when her baby had measured a bit smaller, Dr. Jackie decided against inducing her.
Long story short, they did not decide to induce me or do anything any sooner like I thought that they were going to, because she made it seem like I was about to go into labor like soon or be hospitalized. 3 days later, I'm having these pains. I'm thinking they're Braxton Hicks. I didn't know what was going on. So I called Dr. Jackie's office to let them know. I'm told, drink some orange juice, keep doing this and that. So that's what I did. And it still didn't feel well. A couple hours later, fast forward a few hours later, I'm at the hospital. I'm a couple days shy, 37 weeks pregnant, and I'm told that there is no heartbeat. So to hear a woman, I've been quiet about this story for a very long time. And when my mom touched down into Atlanta, my mom had a lot to say to Dr. Jackie, a whole lot to say to her. But to hear a woman like that, of her caliber, of her demeanor, make such a poor comment that Black women cry wolf, like, that is unacceptable. It's one thing to be somebody on the outside looking in, but it's another thing to have experienced her. That was actually the first Black doctor I've ever had. And to be honest with you, I think that's been the last.
Now, in the latter end of this video, Renee also stated that she did get an autopsy of her son because she just wanted to know. And it turns out her son was absolutely healthy. I think Dr. Jackie has had and will have and continue to have an impact on a lot of these mothers coming forward with their birthing stories in regards to her being their physician. And the really sad part about it is that I have yet to come across one positive video of a mother who encountered Dr. Jackie.
Here's what was scary to me about this. I'm gonna use this as a part 2. I had sons before, but this was my first time having a daughter. The way they treated me while I was pregnant with a little Black girl was like I can't explain it. But my daughter was born at 1 pound. I had to advocate for myself because they said there was drugs inside of my milk and they wanted to test this formula on my baby. They retested the milk. There was no drugs, obviously. Moving past that. Same hospital said to me that my daughter was going to be blind. They said she was born at 1 pound, she's going to be blind. I said, okay, so, what are we going to do? Like, what's the plan? They said, oh, there's these shots, these steroids that you take and you put them in the baby's eye and you go to the back of the baby's eye and you shoot steroids in her eye. And I said, no. And they were like, well, your baby's going to be blind. And I said, if my baby is blind, do you have a cure for blindness? No. So you would like me to allow you Again, we have to remember my daughter was born at 1 pound. You would like me to allow you to test a trial of steroids on my baby's eye, who was fucking born at 1 pound, to see if it works? Well, let me see the data. What has this worked? Has this ever worked? No. Well, we're not doing it. If my daughter's going to be blind, we're going to have to figure that out. You cannot test your steroids on my baby's eyes. Here's the even crazier part. And to advocate for that, you know what they told me? We're going to have to take you to court. I said, I was a stay-at-home mom at the time. Okay. All right, what day? Oh, we're going to send CPS to your house. More than happy to. What day? The tactics that they use to try to scare me to be able to do a trial on my daughter's eyes because I said no was insane. But it took for me being like, okay. Now imagine if I was a single mom at the time, if I was scared, if I lacked resources, if I didn't know how to advocate for myself, what would have happened? Because there was also side effects for this medicine as well. So what I'm saying is learning true advocacy is to understand what systematic oppression is. Learning true advocacy and being a black woman with a black daughter in a hospital where white women are trying to interrogate you and accuse you of being a bad person, a drug addict, and say that you're a bad mother, so much so that they want to take you to court to take away a child. Mind you, we're still not realizing that I just had surgery, okay? I just had this cut open and this baby taken out, and this is what I'm dealing with. No understanding, no compassion, no empathy, nothing. Just we want this baby and her eyes. You're not going to get him. And I'm willing to go to court, and I'm willing to go to CPS, and just like I was willing to have you test my breast milk. I don't play like that. And to say all of this, guess who has 20/20 vision? The daughter that they said was going to be blind. I wear glasses. My daughter that they said was going to be blind and needed to have steroids shot into her eye to test this trial on is 20/20 in her eyes. So I don't want to hear all of this, oh, everybody. No, I know what systematic oppression is. I know what it means to be treated that way because I'm a black woman and presumed to be ignorant, a drug addict, and a bad mother. No, baby, I'm sorry, this Negro reads. The answer is no. Yes, we can go to court. Yes, we can go to CPS. What's up? So, lower your tone, like I always say. My son died. So basically, this is going to be a part 3. So, in 10 months, my son died, and I had 2 children born. But, okay, so basically in January, my son was born. He passed away at the end of May, 2 days before my birthday. Found out I was pregnant with my daughter in June, sort of beginning of July. But I was pregnant when this was happening with my son. And my daughter was born short 5 months later in November at 1 pound. I was also forced into C-section. So I also found out that a lot of women, especially black women, are forced into C-sections for the doctor's sake without any thought to how it's going to affect their body or the baby. So that was also traumatic for me, getting a C-section, because I was also forced into a C-section with my son in January. So I had 2 surgeries 10 months apart. So there was a lot going on with me personally. To all I could do was like speak up and advocate with her at the time. I was still like just shy, not even 6 months from when my son passed away, when my daughter was born. So the only thing at the time I could do is say, I know for a fact I do not do drugs. I do not drink. I'm vegan. I know where the beans came from that I cook in my house. There's nothing in plastics. Like there was things that I could control at the time that I was hyper fixated on. So there was not a shadow of a doubt that I was doing any drugs. There was also not a shadow of a doubt that anybody in my neighborhood was making brownies and drugging me unknowingly. And they were just playing in my face. And I had to advocate for myself and my daughter at the time while she was in the hospital with the breast milk. When my daughter and the situation happened with her being in the NICU, as far as like shooting steroids in her eyes, she was in the NICU. And they were like, well, we need to make this decision. I was like, we're not doing that. So it wasn't until she came home and I was like, okay, like I said, she's going to be okay, that it was peaceful. But you have to understand, like, it was that all that happened to me in 10 months. I was also still raising 2 children. I still had 2 children while the other two situations was happening. So I don't know if that makes sense. I know a lot of people asked me this question and I wanted to make sure I answered. I also want to say I appreciate y'all comedic relief in the comments, because one thing I do is play too much too. So I appreciate y'all bringing joy to the comments. Also, my daughter is okay. She's alive and well. No disabilities, no learning issues. Like I said, she's 20/20 vision in her eyes. So I say all that to say, it's one of the reasons I talk about racism on my page, because I believe it's oppressive, and I know it's systematic, and I know it controls you in a way that you have to speak up for yourself, and there's this danger because you know that you're unsafe. So yeah, so I did, in a nutshell, I did not sue. Also, if this resonates with you, or if you've been through something like this too, I talk about this on my podcast quite often. Click the link in my bio. Spotify, Amazon, Apple, Google, my website. You could listen to it on anywhere. Danielle to you. I'm talking to you. I'm talking to me too. Okay, bye.
Welcome back, guys. And the honest truth is, this is absolutely what Black Americans go through every single day, and it is no longer new. If you would love us to share your story as well, let us know in the comment section, and let us know the emails that we can actually reach out to you, because at the end of the day, a lot of people are carrying a lot of things in their hearts without being able to say it out. Okay, and the main reason why it is good for you to say it out is because at the end of the day, a lot of people are going to learn from this and also know exactly what to do whenever there is literally an issue. I'll just go ahead and let this play.
Black Americans, especially Black women, experience worse treatment and outcomes in healthcare, particularly during pregnancy and childbirth, because of a combination of historical, systemic, and present day factors. This is not about biology, it's about how the system treats people. Here are the main reasons, clearly explained. 1. Racial bias in medicine, often unconscious. Many healthcare providers, often without realizing it, hold false beliefs such as Black patients feel less pain, Black women exaggerate symptoms. Complications are due to non-compliance rather than medical issues. These ideas came from slavery-era pseudoscience and still affect decisions today. Result: Black women's pain, warning signs, and concerns are more likely to be ignored or delayed, sometimes with deadly consequences. Doctors don't listen as much. Research consistently shows that Black women are interrupted more often. Their symptoms are taken less seriously. They are less likely to receive timely interventions. During childbirth, delays of even minutes can be fatal. Result: preventable complications like hemorrhage, preeclampsia, and infection are missed or treated too late. Number 3, structural racism in the healthcare system. Black Americans are more likely to live in underfunded areas with poorer hospitals, receive care at overcrowded or understaffed facilities, lack consistent access to prenatal care. This isn't about individual choices, it's about where resources are placed. Number 4, higher stress from racism itself. Long-term exposure to racism causes what doctors call weathering, chronic stress, higher blood pressure, greater risk of pregnancy complications. Even wealthy, educated Black women face these risks, showing it's not just about income. Number 5, historical trauma and distrust. Black communities remember forced medical experimentation, neglect and abuse in hospitals, being used as test subjects without consent. This history leads some patients to delay care, avoid hospitals, feel anxious or unsafe during treatment. Ironically, this distrust is justified, but it can worsen outcomes. 6, fewer Black doctors and midwives. Black patients often receive better care when treated by providers who share cultural understanding, believe them, advocate strongly for them. But Black doctors and midwives are underrepresented in US healthcare. 7, the statistics are stark, even when controlling for income, education, insurance status.
Black women are still far more likely to die from childbirth-related causes than white women. This proves the problem is systemic, not personal. The hard truth, Black Americans suffer in healthcare not because they are biologically weaker, but because the system was not designed to protect them and has been slow to change. What helps improve outcomes? Black doulas and midwives, patient advocates during childbirth, bias training for medical staff, listening to Black women seriously and immediately, holding hospitals accountable.
The results have showed severally that black people, black women have more higher death rates than the other race. And this is because of some of those things that I've been able to research out as well. And you can also hear from a lot of people's experience. I gathered this clip with a heavy heart. It took me a lot of morale for me to be able to post this here. But just let me know what you think. Credit belongs to the original creators of every single clips and stitches we have in our today's episode. And I want to say kudos to every single mother out there that took out their time to share out their experience. Please do what to also help share your experience. It is very, very important so that at the end of the day, we are going to like open the eyes of so many others to know what to do once they are fine in spaces like that. Okay, subscribe, like this video, drop me your comments, and lastly, do not forget to share for every other person to get this good news. And thank you so much for staying stick and hook with me to the end of this video. And yes, with that being said, with no further ado, I do like I always say in my videos, I'm going to be safe, and I'll see you guys in my next one. For now, bye guys, I love you guys.